Please take a second, pause the video, and read this disclaimer. Today we'll be taking a look at Cervical Flow 1.0, which is several stretches that I've put together that I know that I need for my neck. Now, as always, you shouldn't be doing anything you see on the internet unless you've been cleared by a medical professional, and this is especially true with cervical stretches. Now, here is how I do the nice and simple upper trap stretch. I just try and bring my right ear to my right shoulder, lengthening the left upper trap, which runs from the back of my head all the way down to my shoulder blade. And I just gently have there. It might look like I'm holding onto my head and pulling it towards that shoulder, but I am not. I'm gently using my fingertips to have a sense of where my head is in space and time. Because what I'm really trying to avoid is my chin coming forward, my chin coming back, looking towards my armpit, looking up and towards the sky. I'm just trying to hold my chin nice, neat, and neutral and just tilt. And that hand is really useful in showing me and helping me understand where my head is in time and space. If I just try and do this with my right ear to my right shoulder, a lot of times my head will again move in a way that I don't want it to. So this is not me grabbing and pulling. When it comes to cervical stretches, something you'll probably hear from most every medical professional, physical therapist, whatever, is you never grab and pull. You gently facilitate your head tilting. You can see here how much more tilting I'm getting here. Now, as always, when it comes to my philosophy on stretching and what the science says, 1 minute holds minimum. Why is it a 1 minute hold minimum? Well, that's what the science says. If you do anything less than a minute, if you're doing 15 seconds here, 15 seconds here, you're not actually getting in there and stretching the tissue. You're just kind of giving a little brief stretching feeling and then not really lengthening any structures. That's according to the science. Now, other things that I'm paying attention to when I'm stretching: no numbness, no tingling, no throbbing, no pain. I'm hanging out in mild discomfort. And that's really it when it comes to these stretches. You shouldn't be feeling numbness. You shouldn't be feeling tingling or a lightning bolt or a bolt of electricity shooting down your hand or up into your face. If you do, that's usually a sign of neurological entrapment or something else going on possibly at the cervical spine, which warrants medical evaluation. So one of the reasons why with this one I'm going to harp on 1,000 times that you shouldn't be doing anything that you see on the internet unless you've been cleared by a medical professional to do stretching or exercises of the cervical spine. It is a very touchy place. It has a lot of things going on and it needs a lot of attention. If you're getting numbness and tingling, throbbing pain, there's a lot of things that need to be evaluated. The next one, I take my hand behind my back, chin towards my opposite armpit, and again, gentle facilitation of my hand, gently pulling diagonally, almost towards my right knee there. Now, why is the hand behind the back? The hand is behind the back in order to keep the shoulder depressed. Why does the shoulder need to be depressed? The shoulder needs to be depressed because levator scap, which is the muscle that we're stretching here, is maximally lengthened when the shoulder is depressed. And when I'm having my head go in the opposite direction from that shoulder down towards my opposite armpit, that is putting this tissue on its maximal length. Now, levator trap is a very tricky, sneaky muscle. It likes to hide. It likes to show up on just about everyone who has a little bit of shoulder weakness or scapular retraction weakness, because levator trap is supposed to do exactly what it sounds like it does. It's supposed to raise up your scapula. It's supposed to pull it on up. But what happens in a lot of people is it tries to do the opposite job. It actually tries to grab a hold of the back of your head and pull it on down, or it gets overworked because other muscles in your shoulder or in your back or in your chest are either competing with it or failing to do their job, requiring it to be over-recruited. You've probably heard in the office that 20% of the office workers do 80% of the work. That's how levator scap feels all the time, which is why I'm stretching here. And you can see again, arm behind the back. It's even better if you're sitting on a chair for that right arm to be anchored holding onto a chair, depressing the shoulder, and then head to the opposite armpit, almost like you're trying to bring your forehead down to that opposite knee, and the hand is only there for gentle facilitation of a stretch. I am not pulling on my neck. Trust me, if you get cleared to do these stretches, levator scap is one that will be tight, and it will be letting you know that it's tight, and you will have zero interest in aggravating it. Just like the 20% of the workforce at work that does 80% of the work, if you start messing around with this one, it's going to let you know and it will threaten to quit. Not really, but you get the metaphor. So levator scap, definitely one that is overworked. One of my favorite stretches, one of my platinum level. Everyone that is cleared to do so should probably consider stretching this muscle. Again, no numbness, no tingling, no throbbing, no pain, mild discomfort. And again, this is one that gets recruited to do things it's not necessarily designed to do, but it's trying to help out when other muscles are failing. Next is the SCM. Tilt the head, but now rotate just a little bit, like you're trying to look up and towards the corner of an imaginary building. So just enough that your chin is rotated towards that shoulder. So again, hand behind the back, tilt the head away, rotate the head just a little bit towards that shoulder. Hand on the head again for gentle facilitation, reminding me to keep my head rotated a little bit. If it starts moving out of that rotation, my fingers and my hand are going to give me that proprioception. It's going to give me that sense. It's going to help me know in time and space that my head is moving in the direction I don't want it to go. My SCMs, that's sternocleidomastoids, are incredibly tight. My chin should be able to rotate quite a bit more. I am so tight that I can't really do this. Now, the reason why we need to stretch this way is because of the SCM doing what it does, which is it helps with lateral flexion, which is bending your head towards the side, and it also helps with cervical rotation. So that is what we're looking at doing. That's why you have to stretch it going in the opposite direction. Now, because of these actions, as you might imagine, if you're trying to think of it from a mechanical perspective or an anatomical perspective, there are two different branches. There's the one that is really good at doing the side bending, and there's one that is really good at doing that rotation. And that's why we have to do those two combined motions in order to stretch it. Now, a quick fun fact is that when the SCM on both sides work together, they're going to pull your chin to your chest. So it is a cervical flexor, which is one of the reasons why for me it gets so tight, because I spend so much time at work looking down at my computer, my chin tucked almost to my chest. So that keeps this muscle fired up and active for a lot of the day, and that's why I need to do this stretch. I'm going to be honest, it's not one that I see every single person in the whole world needing, especially from my clinical experience, but it's one that I definitely need, and a lot of desk workers definitely need. And I do apologize for me moving here in the middle of the stretches. There were a lot of bugs. I actually got bit quite a few times out here doing these stretches. It was a beautiful day and the insects knew it. But this has been Cervical Flow 1.0. These are all the stretches I would do if I was cleared by a medical professional to go after all of the low-hanging fruit cervical muscles that get tight, that cause a lot of discomfort and pain. No numbness, no tingling, no throbbing, no pain. If you have any of those, you should be talking to a medical professional. Just mild discomfort is what I feel when I stretch. Thank you all for watching.